And this evening we're having chai and a chat with two wonderful midwives who are part of the Association of South Asian Midwives, otherwise known as ASAM. They have a wonderful logo as well. They're going to share their experience and the work they're doing, as they're both very strong change agents, leaders and midwives committed to improving cultural competence. And I know they're going to share a lot with you this evening. So I'm really pleased. First midwife with experience in the field of midwifery and global health, and she has a strong passion for eliminating inequalities of health with a particular focus amongst women from the South Asian diaspora. Throughout her career, she's ensured that she provides women-centered care with a focus on change and innovation in finding solutions for the midwifery platform. She's been a midwife for 25 years in various roles and at different grades, ranging from clinical to management positions. And in these roles, she's contributed capacity building, training and education, change management, clinical leadership, monitoring and evaluating, quality and risk and clinical practice. And she's now, at the moment, in between that, supporting the RCM with the Bangladesh Twinning Programme as a volunteer consultant. So that's Nafisa. And Sundas qualified as a midwife in 2018, and she has a passion for midwifery and has developed these through her years of training and work career. She believes all women and birthing people should be treated just as she would want her own sister to be treated. That's a wonderful measure for any midwife to have. While she was at university, she became involved in Maternal Aid Association, MAR, a charity which aims to support mothers in resource-poor settings. She volunteered for the organisation for 3 years and was even fortunate enough to travel to Bangladesh to provide free antenatal checkups and education to pregnant women in rural villages. And at present, she's a midwife working as part of the diabetic midwifery continuity team, a new role for which she's very excited about. And Sundas is still in the infancy of her career as a midwife and wants to create positive change for both healthcare providers and service users. She aspires to challenge the stereotypes which she has experienced as a South Asian woman and midwife, and Assam is one way in which she aims to do this. So Nafisa and Sundas, the screen is yours and welcome.
Thank you. Okay. Hello, everybody. I'll start off. My name is Nafisa Anwar, and I'm one of the co-founders and directors of the Association of South Asian Midwives. Thank you, everybody, for listening to our story. So we are a platform that we're a platform that seeks to serve the South Asian midwifery workforce and birthing community, and we sort of want to be the voice. So let me first introduce you to the team. So, for instance, there's 3 of us, 3 midwives who got together and through speaking and discussing things, realized that they shared many similar experiences and decided that they needed to do something, and hence ASAM was conceived. So our first member is Binash Nasmeen. She's a midwife, myself and Sundas. So I'll tell you a little bit about myself. So I completed my midwifery training from City University back in 2002. Prior to that, I was a nurse. And it was during those early years as a nurse that I realized that the NHS, our great NHS, was actually running a 2-tier system. And I realized that, the color of your skin determined how you were treated and what experiences you faced. And once I trained as a midwife, throughout my career, I have faced and seen lived experiences that I myself have faced being from a minority, and I have seen women from my community face behaviors and attitudes and practices that they shouldn't have to face. And that sort of ignited my sort of passion towards inequalities, and it was always on my conscience that, you know, I've got to do something. But when I trained as a midwife, I was the only sort of South Asian midwife at that time, the only woman of colour within my cohort. And when I went to work, I was the only sort of South Asian midwife within that trust. So what I saw and what I experienced, it was very hard to voice anything, because, you know, one voice amongst many is just, it's not heard. And, you know, it creates this fear, this sort of inability to speak out. You know, you remain silent because within our culture as South Asians, we're taught to be, you know, modest, humble, you know, you don't create conflict, and you learn to accept. And that's what I did. And, you know, I saw very lot of things that I didn't agree with and I was very troubled by. And now, you know, I really feel very guilty and very shamed that I couldn't actually speak out for these women. I couldn't speak out for myself. But obviously through Assam, I have found my voice. And my passion is that I want to be that voice for others as well, so that they don't have to face what we have. And sort of within the workforce and the women that we serve, you know, all women should be treated equally and with respect. And, you know, that's what Assam aims to do. So I worked in various places. I was a speaker at the RCM conference. As Sue said earlier, I'm a volunteer consultant for the RCM, for the Bangladesh Twinning Project. I'm at the moment about to start a new post, which I'm very excited of. And my interests are cooking, spending time with my family, and traveling. And amongst that now, Assam is very high on my agenda as well. Thank you.
Hello everyone, my name is Sundar. I'm a midwife and also director, co-founder of Assam. I completed my midwifery studies from King's in 2018, so I've been working for just over 2 years now. What I learned as a student, what I saw as a student, it's so invaluable to me, even today. And so once I finished studying, I came back up north and I took a job at Wrightington, Wigan and Lee, where I stayed for 9 months. And then I came over to East Lancashire Hospital, where I am now. In between that, I was volunteering with Maternal Aid Association, which Susan, you just spoke about as well. It's a great organisation, and I was fortunate enough to go over to Bangladesh and provide the free antenatal health care checkups. I was involved in educational seminars, and what I saw there is still with me today. It's opened my eyes to a lot, actually. And when I came back from there, I presented some of the work that the organisation was doing at an RCM conference. This was 2019, yeah. And that was sort of where Assam first started, really. I'd already heard about Nafisa. I'd seen her on she was on the list for one of the speakers, and I really wanted to speak to her, just obviously with all of her expertise. And then I saw Beanish, and we just sort of instantly clicked and sat and had a sandwich, and we were like, oh, we've got all these experiences, what shall we do? And we just connected. And then it was a restaurant in Birmingham, wasn't it? Because we're all from all over the place. Like, I'm up north, Beanish is up north as well, but Nafisa, you're down south. So we thought, let's go somewhere central, so we went to Birmingham. And we just sat there. We were sat there for hours, just talking about what we wanted, what we experienced, how we can promote positive change, how we can influence this. And that's really where Assam started. And if you, I know you remember, there was a lady sat next to us, and we were just talking. And this lady was like, "Oh, I'm sorry, can I interrupt? But this is amazing. Like, I agree with so much of what you're saying. We should just sat there eavesdropping on our conversation." But it was great. I mean, we shared quite a lot that day, and she had quite a lot to say as well. But at the moment, I'm a midwife. I got my band 6 last April, and I'm now on the diabetic continuity team, which I'm very excited about. A lot to learn. And in my spare time, I like blogging. I like to write. It's great. It's cathartic. It's a good way to reflect. I love baking, love cooking, trying new recipes, and absolutely love the outdoors. Like, this is where I found the llamas the other day. And then there's Binish, who unfortunately can't be here with us today, but I'll just give you a little brief overview. She completed her midwifery from University of Bradford in 2011. 11, I can't see on the side. She was born in Kashmir, and she's come over to the UK. At the moment, she's a specialist cultural liaison midwife. She's also a trustee for the Ireland Midwifery Trust. She's a midwifery ambassador and chair for SDMC Maternity, NHS England. She runs cultural competency and safety workshops. She's also the chair and director of Sheffield Maternity Cooperative, and she's a closet adrenaline junkie. She's abseiled down a building and loves to skydive. And you can see from that list of all the different hats she likes. She says she's got all these different hats. Why? She can't be with us today, but she's amazing.
Yeah,
amazing. Yeah. I'll just hand over to Nafisa again.
Yeah. So, Assam, what were our visions? I mean, we got together because we'd all, while we were talking and sort of talking about our experiencing, I mean, between the three of us, there's about 3 decades of sort of experience, and there's 3 decades of, practice. And when we were talking, we realized that what I was describing and experiencing back in like 20 years ago, Binish and some of us were experiencing and seeing the same thing. So, nothing has changed, even though we have all the data, we have all the studies, what's happening within the disadvantaged communities, within the South Asian and, the Black and brown communities, but nothing have changed. There was talk, but there was no action, and we were all still experiencing the same things. So our sort of vision is, what Assam wants to do is sort of to raise awareness and understanding of the South Asian culture and cultural behaviours and the taboos within our maternity birthing setting, and raise that awareness to the wider maternity team so they have an understanding. Because people make assumptions about things, people have, preconceived notions, and if you don't know, what's behind these notions, you won't be able to give the care which is the right care to these women. And that's sort of what's happening. You have assumptions, you don't understand why certain behaviors are being done by these women, and we have to understand that behaviors to health is very different within cultures, and it's understanding that, and then you can understand why is she, why are they doing this, why are they not doing this. So that was one of the major things that we want to do. And the other thing was to open sort of dialogues again regarding the stereotypes that exist, the preconceptions concerning the South Asian community, because you get to hear things like, South Asian women are very precious, they don't do this, they don't do that, and it's sort of putting that right, that actually, come on, you need to be aware of these things and why they are like that, and eliminating these stereotypes, because once you're labelled, it creates this misconception, and the care that is given is not always the right care, and because the women aren't getting the right care, it creates this mistrust between the healthcare workers and the women that are having the care. And it's, again, if we don't have representation within our workforce from the South Asian community, change will not happen on the shop floor within the communities. So we need to promote and try and get more recruitment within the South Asian communities to come and do midwifery and sort of raise that awareness that it is a good profession, and it will help support our women, it'll help bring about change. And again, when I was a midwife, and I still am a midwife, throughout my career, I never got the mentorship, the support, the coaching, or I never had a role model that I could go to support me to get promoted, to go for interviews. It was as though I was on my own, and it was very hard to seek that. And when you saw your fellow white colleagues getting prepared, getting the support, and they bypassed you, it was very hard. It's a very lonely journey. And after a while, you really think, well, maybe I'm not good enough. You lose that confidence, and you just shut down. So we want to provide that mentorship, that development sort of guidance, career guidance, career pathways, support them, coach them, pre-interview practice, give them that pastoral care. Because again, when you're lonely and isolated and you have nowhere to go or nowhere to talk, you don't have a safe space to air these feelings. It's really hurtful. It's painful. You shut down. Sorry. And again, one of the other things that we really want to do is work with unions again to raise the concerns and challenge and raise the concerns and challenges that we face as health workers and as sort of health workers within our midwifery services, so that they too understand and can support the midwifery population. To you, Sundar.
So these are just a few quotes. I'd just like to read them out. Some staff spoke to me in a loud voice when they saw my brown face. The experience traumatized me to not have any more children. I felt like I was treated quite unequally to the rest of the ladies. I felt so abandoned. I often wonder if it had anything to do with the fact that I was South Asian. And my first experience has traumatized me so much, I can't cope to think about having another child. So these are lived experiences from South Asian women. When we first launched ASM, we'd asked for pregnancy and birth experiences from the South Asian community. This was last June, when all we planned was a little Instagram page, and we received several messages, emails, and unfortunately, looking at them, more of them were negative experiences than positive. And I remember one of the mothers who she sent me the email, and she told me that this was the very first time she'd spoken about her experience. And just reading it gave me the shivers when I read it, because this is what our service users are saying, and it's not okay, because as midwives, as obstetricians, birth workers, we have a responsibility to care for these individuals. And I always think back to when I was younger, and I always saw doctors, nurses, midwives, the hospital setting as a safe space. And looking back, that's probably my naivety, because as a midwife and having listened to these individuals, I can't disagree more with that assumption that I had. And I do think a lot of this does come down to the unconscious bias and the stereotypes and the preconceptions, like Nafisa's already touched on them, about the South Asian community, about the birthing community. Some of the things that I've heard are like princess or oppressed, or how can she handle, how'd she get pregnant if she can't handle a VE, or she must have a controlling partner, or he's not really interested. And as a South Asian, you're already a minority, and from what I've heard from those who are cared for and through reading these birth experiences, South Asian women perceive that they are being treated differently. And these are our service users saying that we feel like we're being treated differently. And I do think when I'm looking after patients who are from a South Asian background, they do open up to me a lot more. And sometimes that's because of the shared culture and the upbringing and the sort of unspoken words that we have. So someone will probably say to me, oh, you know what I mean? This, this happens, X, Y, Z happens. And I'm like, yeah, I understand what you're saying. But it's not just that. And I don't think we can put it down to just having that similar background. I think a lot of it is with the respect and building that rapport, which you can do with anyone, you can do that with anybody. And it's just looking past the colour of that person's skin, looking past the clothes that they're wearing, looking past the language that they speak or the food that they eat, or even the level of English that they have. because the level of English someone has should never ever be a factor in the quality of care that they receive. And I just think we're living in a time where like the digital world is like peaking, you know, everything's happening online now, and we can't really justify not using things like language line and video interpreters and leaflets in various language. And I know firsthand the pressures that you can have as a midwife working like on a busy unit, but this is also a once in a lifetime experience for these service users. And like one of the women here said that her first experience has traumatized her so much she can't even cope to think about having another child, you know. And it's such a change in an individual's life, and we've sort of got that responsibility as midwives, as birth workers, and that first impression that we have can leave such a huge impact on the rest of somebody's life. And I think it's just very important to build that rapport, you know, and to really recognize that this is what these individuals are saying. What can we do differently? What can we change within ourselves? You know, and then move on.
Okay, so one of the things that really came across very clear, I mean, my name is Nafisa, you know, we all have names, but the number of times my name has been shortened, I've been addressed with my surname, I've been asked, oh, can we shorten your name? You know, but no, why? You know, it's not right. My name is my identity. And I remember in my, you know, when I was younger and sort of in my early days in my career, every time, you know, you went to a meeting and then someone would get your name wrong, or they'd ask you, oh, you know, can I call you this? And you start to think, oh my God, why did my mother name me such a name? It's so hard for everyone to pronounce. You know, you start to feel shamed. You start to feel little, small, that, you know, there's always an issue about your name. And then after a while, you accept it. You let people anglicize your name. You let people call you by your surname, and you don't say anything because, again, being a minority within, you know, within an area, and you think, no, I'm not going to upset anyone. I don't want to, you know, and it's that shame. So we decided that, you know, that's just not good enough. You know, just ask us. If you can't pronounce someone's name, ask them as many times as you want, but at least get it right, because that name is their identity. It makes you know, and it's very precious to, I mean, within our community as well, a name is, you know, is very precious. A lot of thought goes into when you name, you know, your children and whatever. So we decided to do our Not My Name campaign, and to make that sort of awareness that, you know, how important it is to just say to someone, okay, how do you pronounce your name? You know, am I saying it right? And you can ask as many times as you want, but get it right, because it's just paying respect to that person. And I think it is so important for that person, you know, and don't refer to someone as it, she, or whatever, because you can't pronounce their name. I mean, I was always called, and I mean, at the time I didn't realize, you know, if someone said, oh, could you find so-and-so, you know, whatever. So I was referred to the brown girl with the curly hair. You know, I've got a name, you know, but that was me, you know, throughout my career. Oh yeah, she's the brown girl with the curly hair. You know, and we've heard stories from students who they've been in uni for 3 years and they've been called she, it, or whatever, but people, you know, aren't calling them by their names because they can't remember it or they can't pronounce it. But that's so hurtful, so disrespectful. And I think it is so important to try to pronounce people's names properly and say their names properly. And hence, so we commenced with our Not My Name campaign, and to create that awareness. And we have got pins available. So yes, sorry, Sundas.
No, it's fine. So just going off what Nafisa's been saying and what I was saying earlier about building that rapport with the individual you're caring for, just a little poem of some sort. Dear Khalid, no, that is not my name. That is my surname. No, not Hatija. Yes, she also works here. Yes, I know she also wears a hijab. No, we do not look alike. We're from different ethnic backgrounds. No, not all Asians are Indian. Please call me Sundis. Yes, I have a nickname I go by, but my name is Sundis. Kind regards, Sundis Halid. This happened to me so much whilst I was at university. Me and one of my good friends, she also wore the hijab. We were mistaken for each other for 3 years. Even having worked with a mentor for such a long time, I was still mistaken for her because we both wore hijabs and we both had brown coloured skin. And I think this is an issue we need to address with ourselves first and foremost. And I say this because I probably have been guilty of this in the past myself. I'll put my hands up, you know, and just because I'm South Asian, I'm a minority and I face these issues, it doesn't give me a free pass. It doesn't give me a free pass to say that, oh, it doesn't matter what I say to somebody else. A name is an identity, you know, and one of the first questions as midwives, when we meet somebody who's pregnant, we ask them whether they know what they're having or what have they decided on a name yet. And it's a conversation starter, and this is how we build rapport. And it's one of the most important decisions parents will ever make, you know, what will we call our child, and it stays with you. And like Nafisa was saying, in our community, a name is so important, and there's a full ceremony to name the child, and you'll know of people in the community, family members, friends, who, when they've looked for a name for their child, have put a lot of importance and consideration in how their name will sound when they go to school, how their teachers, their peers, how their colleagues will pronounce their name. And we owe it to those that we care for and our communities that we just ask the important questions, like Nafisa said. Just ask, what is your name? What would you like to be called? Or how do I pronounce your name? Apologize, say, oh, I'm sorry, I might mistake you. I might get your name wrong. How would you like me to pronounce it? And it's just building that respect, you know? Name is your identity. The least I think we can do as individuals is pronounce somebody's name right or get somebody's name right. And yeah, I'm just gonna move on now, Nafisa.
Okay, so I mentioned representation earlier, and this is just from the NMC statistics showing you know, what percentage there is of the South Asian workforce. And we can see, if you go across, you know, there isn't good representation. I mean, you know, this is the facts, you know, and we really need that representation to make those changes to happen within the community. And it's about recruitment, but it's about proper recruitment in the sense that campaigning and making the interview processes sort of fit for everyone. You know, they should be sensitive, they should be appropriate for everybody, because a lot of the interview processes, you know, aren't sort of suitable for people from our communities, because our communities, it's very cultural. Midwifery, nursing aren't considered good professions. You know, if the option was there, medicine would be the option to go and study, because it has more status with it. And also there's this misconception about our profession that, you know, especially for unmarried girls, you know, why are you working, you know, why are you talking about vaginas, why are you talking about menstruation? You know, these are all sensitive and taboo topics within our communities. And again, we need to work with the communities to try and address those issues and tackling and raising and opening up those sensitive conversations. So we really need to work at recruitment, about starting from, say, school level, going out there, talking to the girls, talking to the communities, that, you know, this is a good profession to be in, it's respectful. And by having midwives within the workforce, it will help bring about change and improvement for the women that we serve. So that is very, very important. And again, stigma, cultural sort of thoughts, these all attribute to, again, why our girls don't want to come into the profession. And it is very important for us to try and overthrow these perceptions.
Yeah, just adding to that, in the reference list that we've sent you, There's actually a study that was conducted to see what the barriers and enablers were for UK homegrown South Asian students when choosing nursing and midwifery careers. And one of the issues was stopping the NHS bursary, just starting on that level. And for some people in the community, taking out a loan, it wasn't something that they would do according to their religion. And this is what stopped a lot of people. They were reluctant to pay for the price for university, really. And I don't know if you mentioned about the racial discrimination, and even within the university applications, the concerns that even if an individual gets onto the course, does that mean that there'll be any scope for progression, any career progression, just by looking at the representation that there is in leadership today? You know, they look at that, they say, I don't see anybody there who looks like me, who I can relate to. So why should I join this course? Why should I become a midwife? Why should I become a nurse? And actually, a lot of what was said, even within the community, about like the taboos around midwifery as a vocation, I experienced that when I had people call up my parents and ask them why they've let their daughter study something when she's unmarried and she should have more shame than to be talking about these things. But it's not right, you know. And I always say it's a double-edged sword, and you can just see exactly how it is. It's you've got the racism, you've got the stereotypes, you've got the discrimination, then you've got the cultural taboos, you've got the community, and it is hard. It is really hard. And I'm just going to go on to a little bit more about that now, actually. When talking about what being a minority feels like, what being South Asian feels like, it is this. It's waking up every day and fighting each stereotype that exists about me. It's having to fight, and I think Leticia would agree, we're just fed up. You know, you're fed up of having to fight and having to sort of explain yourself, and constantly being asked all the answers to all the latest headline in the community. And it sometimes feels like you're the spokesperson for the entire community when you're not. You know, I'm just me, you know, just waking up, going to work, you know, and
respect me for who I am.
Yeah, exactly. And I think we need to work on that as well. It's a collective thing, you know. We need to work on it within the community. We need to work on it with healthcare providers, and a lot of what we're doing within ASM is based around that. We'll just go on.
Okay.
Nicely
to the conference. So one of the things that ASM is doing, and we're very excited, we've collaborated and we are co-producing a conference which is going to be on the 12th and 13th of November, and it's called Through the Dark Lens Conference. And basically it's celebrating, because, you know, we always hear negative things about the Black and brown communities. So what we thought, we want to celebrate Black and brown excellence within perinatal health, because there are some fantastic Black and brown people out there who are doing amazing work, all individually, but it's never acknowledged. We don't hear about it. So this conference is to celebrate that, because we are resilient. We've come through it. You know, I've been 20 years in the profession, but I'm here. I've gone past that. And this is just starting, but, you know, she's doing it. And we just feel that, and it's collaborative work. We're co-producing, you know, we're linking up with our Black colleagues, and we're doing this. So it's going to be a conference not to be missed. Put the date in your diaries, 12th and 13th. We're going to have some amazing speakers, amazing workshops. So please, 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 it's one of a kind, and just watch this space. There'll be more information.
I think it's less of fighting and more celebrating.
Yeah.
Yeah. And just finishing off now, I know we sort of limited on time. It's so what next? You know, we're here today, we presented. What are three things that we want you to take from this today? And the first one is you know, just understand yourself, understand the biases that you might have, the stereotypes of preconceptions that might exist within yourself, and clear them. You know, look at our South Asian service users, your colleagues, as equals. with that mutual respect for each other, and understand how the care that you provide can really make or break somebody. And this responsibility to be more aware, to have more patience and understanding, it begins with ourselves, and we need to be holding ourselves accountable for what we're doing. The second thing is time. You know, it's a lot. What we're talking about is a lot, and it can be quite triggering. And just taking the time to take it all in, and things affect us all differently at the end of the day. And what we want it to be as raw and unfiltered as possible, and we always have tried to do that. And just understand how you feel about all of it, and take the time to understand who you're caring for. And finally, the last thing is community. You know, make a conscious effort to open up these conversations, build a healthy community who we can learn from each other, and who are willing to learn, and just building reports for those who you care about, you know.
Can I just add as well, sorry, just to add on that every woman, irrespective of who they are, where they come from, and as health professionals, I mean, one of the things that we believe is we do no harm, but we are doing harm, because look at the statistics. So all we need to do is respect everybody and treat them with humanity, and that's all it is. So yes, so I just wanted to add that.
We'd just like to leave you with this quote. Fear is just a line in your head. You can choose what side of that line you want to be on. You can't let fear control you. This was a quote by Sabine Mahmood. She was a Pakistani individual who lived to challenge injustice and discrimination. And unfortunately, she was shot and she passed away. And I guess at the end of the day, what we're trying to say is you cannot let fear control us. You know, there's a fear that comes with speaking out, which we've seen why there's that fear with speaking out, just by what's been going on in these past few days. And I think it's just choosing where you are on that line. And thank you, guys. Just some
contact information. Yeah. Thank you.
Fabulous. Thank you. Thank you so much, Nafisa and Sandes. I've probably got your name slightly wrong, even though I did check. That was fantastic, and you've covered a huge amount. And thank you so much for sharing that, because I know I've heard people saying that they're fed up with having to tell their stories, because we should all be listening. But I think you've been very open and very clear on what needs to be addressed. I mean, I'm thinking the biggest thing really was the recruitment into midwifery, bringing more students from the South Asia, well, from women of colour into the profession, because that way you will get people that look like me in positions of power. So we need to really work very hard to get midwives into positions of leadership, which should have happened way before, and it's taking a long time. And the numbers, that was very helpful, pulling out those numbers from the NMC actually, and addressing the issue of whether it's a good profession for women. I mean, how can we make it more attractive for women, South Asian women?
That's a good question.
I know.
That's a good question.
I think it's working together, you know, like I was saying about community, working together, talking about these issues, and not just doing something with them. Like just understanding that these issues exist within the South Asian community. This is something that could be stopping individuals from choosing midwifery, choosing nursing as a profession. And then talking to healthcare professionals who are South Asian, you know, and I think it's sort of collaborating, which we're trying to do a lot. We're trying to get into the community, work into the community from ASM. But it's going to take time. You know, these things don't happen overnight, and we've got the time to give. We want to give the time because we want to see the positive changes. We want to see the improvements.
And you have quite a wide-ranging strategy, which is to support the women and support midwives coming in. And also, I mean, I was very interested by Nafisa's concept that there wasn't a mentor and no one helping to kind of prepare you, because that's I've heard that before from midwives who haven't felt as though they've been nurtured or encouraged to go for any promotion, and it's kind of a lot of white midwives would just take it for granted, I have to say, that it would happen. And it's, I suppose the other thing is, how do we as white midwives not feel terribly guilty for the things that have happened in the past? I think that, because that seems to come over to me when I hear, you know, it's like the where people say Black Lives Matter, and someone will say, well, white lives matter too, because they don't understand what that phrase actually means. So how do we address ensuring that all the midwives in the team can feel that they're not, you know, it's not your fault that I'm not doing well? Do you see what I mean?
Yeah. It's by acknowledging us as individuals and not trying to make us feel different. It's that inclusiveness, isn't it? It's to include us. It's to treat each of us as individuals. We're all different, but we're human. We're all different, but we're the same. And it's acknowledging what backgrounds we come from, how class, race, religion has an impact on people, but it's acknowledging that and respecting that, and not sort of undermining the fact that you come from a different culture to what you do, and acknowledging that, yes, you don't look like me, but I'm better than you, because that's the feelings that we face all the time. You know, you feel so isolated, and after a while it really, really chips away at you. You know, you really start to lose that confidence. You know, I wouldn't be here a year ago speaking like I am, and you can see it gets me all worked up, but that's how it is. But it's like I always say, I found my tribe, and Assam has given me that sort of space, and we want to do that for others as well.
That's fabulous. That's what we need from you, because we need to know. I'm owning that one. I would need to know. I mustn't hog all the questions. We have got questions coming through, and audience, one person is asking about the slides. They will be available after this date, so you can get the slides and you will have the resources. And I've had a question from Hamdan Sajid, and who says, hi Sandas, I'm from Pakistan here. Which book would you recommend for pediatrics? Gosh, that's a big question.
I'm not sure I would be able to help with that. Sorry, don't really know much about pediatrics.
But we can find out. We can do some research and find out, and we can pass that on.
With my midwifery head, I'd be thinking something like Roberton personally. But I mean, that's, you know, my other midwife colleagues might have something different. Okay, so we've got a comment from Rosamond McFadden, who says, sorry, Rosamond, I got your name wrong. I do beg your pardon. It takes longer getting a name wrong, insulting someone by making assumptions, than it does to say, how do I pronounce your name? That's a really good point. Thank you, Rosamond, for making that.
Yeah.
And Joy Palmer says, and hi, Joy, long-term friend here, the interview panels for prospective midwifery students should be representative of the communities that are being served. Unfortunately, this does not happen. I think I would have to say, on universities' behalf, I think they're trying to address this, but it is difficult, because if you look at the numbers of midwives there are that you want to bring in to help, there's not enough of you, but we'll grow it. Okay, hopefully. And Deepa Santosh says, sometimes midwives take the role of a border agent with the wrong information. Like I've seen someone say to a person new to the country, no access to public funds means no access to NHS care. I have to challenge that, to say that's not true. It just means no benefits like child tax, but absolutely entitled to NHS maternity care. That's absolutely right, Deepa. All women have access to maternity care. So I think that was a comment again. And Lola, hi Lola, says, thank you ladies. Is there anything that those from other communities can do to help with recruiting more people from the South Asian community? Good question. Thank you, Lola.
I just think I just keep saying about just just speaking to us, speaking to individuals who are from a South Asian background, and looking at what struggles they have, because I know we say South Asian community, but it's not a homogenous community.
No.
There are so many different cultures, traditions, beliefs, religions within that one community, and just acknowledging and understanding the differences in them all, and not treating them as one. And I know today we've been saying South Asian, and even ASM is Association of South Asian Midwives, but we're inclusive of all the different cultures in that. And I think going forward, it is like, if something has worked for another community, let's talk about it. What has worked for you? What can work for us? Because this is obviously, ASM is less than a year old, you know. We're still learning, but yeah, it's just collaborative work.
It is definitely collaboration. I think is a big key. It's about sharing models of, you know, things that other communities have done, and applying that, because if it's worked for you, it'll work with us. Yes, we might have to tweak it, we might have to adjust it to put into our communities, but definitely sharing and collaborating. And I think, again, sort of when about promotion, for instance, having more representation in, I don't know, in flyers, in university prospectuses, you know, having more people like us on the covers, so that people think, well, yes, there are, you know, having our stories out there, that how great it is, and making it more inclusive, so that the communities can actually see. And for us actually to go out to the communities as well, as I said earlier, to go to the schools, to go to, you know, with the religious leaders, whoever, to do more collaboration with them and talk about it, because I think it's opening that subject as well.
And I think it's just thinking outside of the box, being innovative, being creative with it all, you know. Just have to do things that might, when you think about it, might sound a bit all over the place, but actually it will work, you know, and just not being afraid to try these different things and see what works.
And I think midwives are very creative on this. I mean, I think Nafisa, what you were saying about images and flyers and things, that's a really good point, because you may know I'm editing the new May's Midwifery, and we're making very stringent attempts to make sure that we address this, because it's really, really important. But I know that when you look at images for publicising things, a lot of people will use images from photo banks, and they are overwhelmingly white middle class looking women with white middle class looking midwives, and often with nail polish, which drives me mad, because you wouldn't as a whatever, because those are the images that are stocked in the sort of photo boxes. So just addressing that. So maybe that's another issue for you and for other colleagues, to get images into these photo banks of much more representative of the people we are as a profession, but also those women that and babies that we serve. So that's really good point. Okay, now we've got 2 comments. They're coming through on my little screen, which is why I'm looking away. Laura Krolik, I'll be a student midwife from January 22nd, and all students need to hear you both. You're amazing, and your words have really educated me. Well, good luck, Laura, and well done for being appointed. It's getting a place on midwifery is really hard. So go out and share on all the different mediums to get more people in, as many as possible. We've got Alison Nicol, who says, thank you for your great presentation. It's really made me think about my prejudice. It's also like the do no harm statement. Thanks again. And Binish. Sorry, Binish, I always get it slightly wrong. I'm so sorry. She says she's so proud of her team, and I think very much so. She should be. That's fantastic. I don't know if we've got any more questions. I mean, I had a little question about this, because I know you use the term black and brown. Sometimes it's using women of colour. It's difficult to get it right, and I know people do get uncomfortable about this. What is right at the moment for you guys?
I think what's right is what like when it comes to like going back to saying about asking somebody's name, asking somebody what is right for you, you know, that's it, because it's not about us, it's about that person, and it's about what that person was comfortable with.
Yeah.
Okay.
Don't put us into a category. We're individuals, and I think that's the key. It's like the term BAME. I mean, we're already a minority, but by putting us into a category, it's everyone bar white people. So we're again another minority within a minority. So it's like that. You know,
no,
do we actually need that sort of labeling?
I think it's almost like a shorthand, isn't it, to kind of get all those in. But it's no, it's a good point. It's a very good point. And it's I think the issue about the asking of the name and then what do you see yourself as? It's actually, what's good is it does open up the discussion with women or with colleagues, doesn't it, about and adds to our understanding of the issues, because a lot of the issues that you were talking about would have been alien to me as a midwife or as a student midwife, because I'm kind of privileged in the position I'm in, or that I was in at that time. Okay, we've got Deepa Santosh, who's saying, I signed up to being a student ambassador at my university, particularly to recruit the next batch of students. Well done, Deepa, that's fantastic. What a way to end. I don't know if you want to make any other comments, because I could listen to you both for ages and I could throw loads. I have still got questions, but I know we have to be disciplined about the hour that we have.
Just thank you for having us, and Nafisa, and like even Binish, you'd all agree we could go on and on and on. Like we really like cut it short with what we're saying. But it's just ask if you've got any questions. Our contact details are on there. You can DM us, tweet us, email us, check out our website. And just thank you.
Same here. Thank you. And it's fine to ask us. We don't mind. Don't assume. And I think what I would say is, you know, every woman that comes into your care, don't have preconceived ideas. Treat them as an individual. But if you don't understand something about her behavior, whatever, ask, you know, why is it that this is happening, or why is it that you want this? Just respect her culture, respect her tradition, work with her. As health professionals, we should look at everybody the same. We're not there to be judgmental or criticize. You know, we should respect everybody, and it is about respect.
That's a fabulous way to end. I think I've got scribbled on my notes challenging assumptions, and I sometimes think we're so busy, we think we haven't got time to just ask. And you've really emphasized how important it is to ask, because actually if we ask and we challenge our own assumptions right at the beginning, get the woman's name right, and understand more about what makes her maternity care right for her, we'll save time in the long run, and the woman will have a much better experience and better morbidity and mortality, which is at the end of the day what we're really trying to challenge. So thank you, a huge thank you to Nafisa and Sundas. Thank you for spending the time to help us understand more. I think we might be inviting you again at a later date, maybe when you're older than a year old.
Thank you, it would be a pleasure.
Fantastic. And just to the audience, all of the contact details are on the resource list for you to access. So just another thanks to Matflix, and thank you to our partners, the Practicing Midwife Journal and All for Maternity, for their support. We'd just like to thank Sundas and Nafisa again. Fantastic, as always. And just to say that next week we'll be here at 7 p.m, 7 till 8. And as a final comment, just good night. Thank you for tuning in, and take care of yourselves.
Thank you.
Video streaming from maternity experts. All your CPD and revalidation needs met in one place. Our expertly curated box sets are the perfect way to engage with the latest thinking, issue by issue. They make revalidation easy and are the perfect accompaniment to any project or university coursework. In addition to video from expert speakers across maternity and midwifery, there is easily accessible research and links to the latest government policy documents. Our reflective questions at the end are the perfect primer for your revalidation. In the same way the Maternity and Midwifery form provides certificates to show that you have attended these festivals, we can provide certificates for those who have consumed the content of a box set and submitted their written answers to the reflective questions provided by our curator, Dr. Jenny Hall. Midwives, maternity professionals and students, do not miss out. Subscribe to Matflix today. Box sets are just £17.50 each, or access to them all starts at £8.99 per month, and only £5.99 for Maternity and Midwifery Festival attendees. Students pay just £2.99 per month, and only £2.49 for Student Maternity and Midwifery Festival attendees. Check out the box sets at www.matflix.co.uk.